One of the most common things that I give my patients is an indoor or an outdoor lacrosse ball. An indoor lacrosse ball is a little bit more squishy and spongy and forgiving. The outdoor lacrosse ball is actually very hard. It's a very firm rubber ball and it's less forgiving, but it really can dig in and hit more specific trigger points. And that's what we do with these balls. We actually go in and attempt to break up muscle tension, trigger points. It's your own self massage. Okay, the two areas that I like you to work on this is going to be the upper back area into the traps and also in through the big glute muscle, both glute medius and glute maximus. Glute maximus is the big muscle that's in the back. It's what we think of as mostly, when we think of our buns, we're thinking of glute maximus. And it's a powerful driver to push you more forward. That's going to have some trigger points, but the bigger area that you're going to find a lot more trigger points in is going to be glute medius. And glute medius isn't the big powerhouse in the back. It's actually more on the side of the glutes, in between the femur bone on the side. So that's that lower bone that you can tap and hit, and the actual pelvis, which is going to be that crest or that bone that you can feel up on the top. Now, what's important to understand about using this ball is you're going to go to tolerance. You're not trying to beat yourself up, and you're not going to do this for an extended period of time all at once. Instead, you want to basically touch it, make some changes, and then walk away from it and come back when you're having maybe a low back pain episode every 4 hours. But like routinely, I do this almost every single day. Break up tension into my glutes, break up tension on my upper back. Those big drivers, the shoulders and the hips, are the ones that we just want to break up the tension and make sure we have really good mobility. What it looks like is this. So in that leg, you're going to kind of tap up to the side. You can feel that lower bone, and then there's this fleshy area. That's where we're going to start. So you're going to start perpendicular, put that ball into that area, and then since the ball is only a couple inches, you literally have to go up and down, forward and back, and you're going to just scan around and you're going to look for any type of tenderness that you might have. Commonly, people will have more pain on one side than on the other side of the hip, but if you're really bad and you've had a lot of chronic back issues, you're going to find this on both sides. When we're actually on the side of the hip, there's no nerves over there, so if you're having really sharp, excruciating pain, just back off a little bit, but still try to break up some of that tension. And as the days go by, you're going to have less and less tension, less and less pain in that area, and you're going to be able to really feel the difference in through your hips and even in your low back. After you've worked for 30 seconds to a minute, start to move back into that glute maximus. Really big muscle, a lot of surface area, so you're really going to have to scan around and try to find any type of pain or discomfort that you have. Then obviously you're going to do the other side. So find that muscle fleshy area, break through, start to put that hips, you're perpendicular to the wall, you have a little bit up and down. When you find a tender spot, like that's actually a little tender on me today, you hold it for 30 seconds or so. Once it starts to melt, relax, then you just keep scanning, looking for another spot. Altogether, think about 1 to 2 minutes on one hip, 1 to 2 minutes on the other hip, and then you're going to start to work through your shoulders. With the shoulders, okay, so you got that big wing bone on the back, that's called your scapula. You want to get in between there, that's called your rhomboid muscle. So you're going to scoot down a little bit, lean against the wall, put that ball over your shoulders and lean forward a little bit so that ball can roll down your back. Then give yourself a little mini bear hug to get that scapula away from that spine, and you have a couple of inches from the spine to that scapula that you can just roll through, and again, trying to find any type of muscle tension that you might have. After you've been there for a little bit, go ahead and reposition the ball, and then you're going to go through your upper trapezius, which is that big muscle on the top of your shoulders, and then also this muscle called levator scapula, and this is a troublemaking muscle. It can cause exertion headaches up in the neck. You can have that burning sensation, tightness in through that upper back, and it can even alter some of the movement patterns in your shoulders. So after doing this, you may even notice that you can raise your shoulders a heck of a lot easier. So what that looks like, again, you reposition, you don't let that ball sink in between the shoulder blades, lean forward, and you may even have to be at an angle, and again, you're just going around that muscle fleshy area, looking for any type of tension that you might have, and then hold that position. Again, same concept as the low back. If you have a lot of pain, ease off a little bit. Use a little less pressure. But as you make progress, you can push a little deeper and a little bit deeper into these muscles and you'll have a lot more range of motion and less discomfort. There are a couple other areas that this ball can be very useful, and it has to do with some of the rotator cuff muscles in the back. So teres major and teres minor is underneath the shoulder itself. So you have to lift your arm up to get in there, and you'll find it's just point tenderness in the back of the shoulder itself. So lift that arm up, go ahead, position it in there, and then just roll around and spend a few seconds to a minute and just try to find any type of tension that you might have in through that area. If you have it, go ahead and work it out. If you don't have it, go ahead, switch to the other side, see if you can make some progress with that one. Use this every day. I keep one of these in my suitcase cases when I travel. I have them around the office. I usually have one in a vehicle. This is something that I use all the time just to break up some of that tension, because if you're exercising, you're obviously trying to gain strength, trying to get better, but you're also going to cause a little fatigue and breakdown. So if you can drop that tension with a lacrosse ball, you're going to heal faster, recover faster, and have a lot less discomfort.